One of the important topics which touches our lives today is the laser. What is laser? Many people are sometimes worried about lasers and think that it can cause skin cancer, and others are thinking that laser is a magical stick which can do everything. As a matter of fact, laser is a concentrated beam of light with certain characters which make it different than any other type of light, and it has many applications in medicine, whether it's in dermatology, dentistry, gynecology, surgery, ophthalmology. It has many applications, and in those applications we can use the laser to cut tissue, where we are using it with certain types of laser, and this can induce cutting in the skin, and in this case it has advantage over the scalpel, where it coagulates the blood vessels so it minimizes the bleeding, and also it seals the nerve endings so the pain associated is going to be much less, but still it is a tool to cut the skin. However, in many other applications, we are using the laser in a very selective manner, where we are using different types of laser to affect the pigments, like what we are using in hair removal with the laser, or in treatment of benign pigmented lesions and tattoo removal. Sometimes we use the laser to treat vascular lesions and vascular nevi, where we are getting a laser which is targeting the hemoglobin to treat vascular lesions, and in this case, it will affect the vessels more than any other target or structure in the skin, so it is more selective. According to the type of laser application, we have different reactions of the skin. Sometimes we are using the laser in ablative manner, so there is a wound which needs a proper wound care afterwards to avoid complications, and sometimes it doesn't have any wound in the skin and the care is going to be different. But the bottom line is that when we are using lasers, it's important to use the appropriate skincare products, like something to promote the healing and sunscreen to avoid the hyperpigmentation afterwards. The other thing which is important is a common question about laser and if it can cause skin cancer. And actually, during the past 30 years of using laser, there is no reported cases of skin cancer development after the laser treatment. It's important to know that laser is a collimated coherent beam of light. It is non-ionizing radiation, and this differentiates the laser from ionizing radiation like X-ray, where there is an exposure limit after which we have to stop exposure to this kind of radiation. However, when we are using the non-ionizing radiation like laser, there is no limit of exposure and it's very safe to be exposed to, and there is no limit of the number of sessions we are having with the laser. On the other hand, if we are treating an area which is having any pigmented lesion, we have to make sure that this is a benign lesion and it's not suspicious. That's why it's important to be examined by a dermatologist before we use the laser on a certain area of the skin, because if there is any lesion which is suspicious, this should not be treated with laser. This should be properly examined, maybe biopsied, to make sure that this is nothing to worry about before we start to use the laser for. On the other hand, a very popular question is regarding using the laser during pregnancy, and I don't prefer that we treat pregnant women, because during pregnancy there is increased production of a hormone which increases the skin pigments, the melanocyte-stimulating hormone. So any trauma to the skin, whether it's due to laser or any other cause, can cause hyperpigmentation. Also, if there is any problem in that baby while the lady is pregnant, then this is going to be referred to the laser treatment, and the laser is going to be accused for that. So it's much better to postpone any laser intervention during pregnancy till after delivery, and then we can use the laser very safely. Those are things to be considered. Laser is not a magical stick. It is not a very dangerous tool, but like any other procedures, as long as we use it properly, then we are getting very good effect with minimal amount of side effects. If we use it in the wrong way, then definitely we are going to have some side effects, and this should be avoided by appropriate training of practitioners before they use the lasers. So this is important information to know about the laser, which I really like, and I feel that it adds a lot to the tools we are using as dermatologists in dealing with different skin conditions.